Welcome back to the Asthma Education Home Study course. Once again, my name is Brian. I am the lung coach, and today I'm going to be talking about irritants and other triggers. While most triggers for asthma are allergy related, there are some major triggers that can be maintenanced and managed to help control your asthma. Today I'm going to be talking about exercise-induced asthma, or asthma induced by viral or bacteria infections, or asthma triggered by drug reactions or trouble managed asthma, such as the case with adults who have irregular heartbeats and may be on heart rhythm medications, or beta blockers is a term that is a type of medication that blocks one of the receptors that we use in asthma pharmacology or in medication to use to treat asthma. So we're going to talk about that a little bit. And we're also going to be talking about co-conditions like those irregular heartbeats, or maybe sleep apnea, or COPD, chronic obstructive pulmonary disease, or maybe even just heartburn and acid reflux, also known as GERD, can trigger asthma. And then there's other irritants, environmental irritants such as air pollution, tobacco smoke, perfumes, and wood burning, fires. So we're going to talk about these in a little depth here. Let's talk about exercise-induced asthma. This is a type of intermittent asthma that can be treated before exercise. If you have symptoms of chest tightness or wheezing or cough when you exercise, you may have exercise-induced asthma, so you want to talk to your doctor about this. One of the things you can do is about 5 to 15 minutes before you exercise, use your rescue inhaler, take a nebulizer treatment of your albuterol, and then you can exercise normally, hopefully. So, once again, you want to talk to your doctor, but if you have asthma symptoms during exercise, you may have exercise-induced asthma. This can be particularly important for runners who run in the cold air. Cold air can trigger asthma. Simply inhaling cold air while exercising can cause those asthma symptoms. The other thing we want to talk about today is viruses like influenza virus or rhinovirus, the common cold, or a type of virus called respiratory syncytial virus, also known as RSV. It triggers a lot of asthma symptoms in small children. So these viral infections, to prevent them, you want to make sure and see your doctor for your regular checkups, for vaccinations, and for screening for viruses. That way, if you need additional support, you can get it from your doctor. We're going to talk about co-conditions or comorbidities. One of the big ones, obviously, is chronic obstructive pulmonary disease, known as COPD. And this is why it is so important that if you have asthma, that you do not smoke cigarettes. It is so important that you don't smoke. Because while you may not feel the effects in your teens and 20s, later in life, when you're in your 40s and 50s, you will have troubles with your asthma if you smoke. Also, if you have children with asthma, you should not smoke. Please, I implore you, do not smoke around your children with asthma. Quit. Do whatever you have to. If you care about their heart and lung health, you will quit smoking cigarettes. So, those core conditions can also include sleep apnea. If you have sleep apnea, you can have nighttime awakenings with shortness of breath. This can be also a sign and symptom of asthma. So it may be important that you have a sleep study. Also, gastroesophageal reflux disease, known as GERD, can also cause asthma symptoms. When you aspirate stomach acid into your lungs, it can cause shortness of breath, chest tightness, wheezing, and coughing. So, if you have GERD, once again, you want to get with your doctor so you can manage that and not trigger your asthma symptoms. Another co-condition is heart conditions, such as congestive heart failure or arrhythmias. This can trigger asthma, especially when we combine it with the drug reactions. If you have a heart condition, you may be on a heart medication that blocks the type of asthma medications we use to treat that. So you may have to get with your doctor and develop a specific plan to manage your co-conditions or your comorbidities. And once again, with those drugs, if you have heart conditions and you're on beta blockers or ACE inhibitors, you might want to talk to your doctor about alternatives if your asthma is very severe. Okay? And finally, another quick subject on drug reactions is NSAIDs, or non-steroidal anti-inflammatory drugs. This can include ibuprofen, aspirin, or any other NSAID really. You don't really want to give aspirin to children anyway. However, if you do happen to use those, be careful with your child with asthma because they can cause severe asthma attacks. So, once again, this is about developing a care plan with your doctor, with your respiratory therapist, with your nurse. You want to develop this plan specific to you or your child. And make sure you watch out for these things because you don't want to end up in the hospital for an asthma attack with your 3-year-old because you gave them aspirin, which you shouldn't give children aspirin anyway. Usually Tylenol is safe, acetaminophen, or children's Tylenol. Be sure to talk to your doctor though. If you have a very severe child asthma, you may want to avoid these and get alternatives. And I want to go back real quick and back up a little bit and talk about tobacco smoke. If you have children and you're a cigarette smoker and they have asthma, it does help if you smoke outside. That's true. However, the cigarette smoke on your clothes can trigger their asthma. You should not smoke in the house at all if you have a child with asthma. And if you have asthma, you should not smoke. I cannot stress this enough. There's not as much evidence or studies regarding the relationship between cigarette smoke and asthma, but from my own personal experience in emergency rooms and hospitals, tobacco smoke is a big trigger for asthma conditions. So if you're a parent and you really want to do the best and have your child in the most healthy environment, please try to quit smoking. There's tons of programs out there. Get with the 1-800-QUIT line. American Lung and Heart Association have some programs. So do whatever you have to. Do whatever you have to because COPD and asthma is a very, very tough combo to treat in the hospital. So that's my little rant again on cigarette smoking, and don't do it. Do whatever you can to quit smoking. Get patches, get gum, get medications, okay? So thank you again for joining me. I will see you on lesson 6. Thank you.